you suspect that someone is overdosing, paramedics say the first thing to do is call 911. While the paramedics and firefighters get there as fast as they can, sometimes someone else needs to step in. Giving someone Narcan as a nasal spray can save someone's life until they get to the hospital. Advanced Medical Transport in Peoria shows us how you can administer Narcan.
The kits that are provided to the public are intranasal typically. So they go through an atomized mist up through a person's nasal passages and get absorbed through mucous membranes.
Narcan can be purchased over the counter. Many places give it out for free for the community, and they can administer Narcan themselves. They don't have to have a prescription or a doctor's note or anything like that to be able to administer it.
So calling 911 first is great, and then just following the instructions, and they're really simple. It's actually easier for a bystander to administer, and the directions are very simple. They're printed on the box. Even if you don't have that, it's very easy to figure it out. You take the cap off, and as long as you get it in the proper place where it can reach the mucous membranes in the nasal passages, it actually works very quickly.
When we respond to somebody with a suspected opioid overdose, we always assess their level of consciousness, if they're awake or not awake, and then look for other signs that they may possibly have an opioid on board. Things like suppressed respiratory drive, as well as pinpoint pupils are large indicators that somebody has an opioid overdose. So we will administer Narcan in a mist up through their nose, and it will help restore their respiratory drive.
So now you know how important it is to have Narcan, as well as how to administer it. But where can you get it from? You can buy it over the counter, but there are also many resources in Central Illinois that give Narcan and fentanyl test strips out for free. Some organizations like Jolt Harm Reduction on Sheridan in Peoria have them available at their location. But as you will see, there are vending machines and boxes all over.
You have Narcan here?
I do, yes.
And anyone can just come.
Anyone can come get it. And we have a vending machine that has Narcan and the intramuscular injectable naloxone. The health department and Carl Health has also got a couple of boxes around the city. We're looking at more. We have one in the East Bluff right now by the East Bluff Community Center that's just kind of embedded in that community. Our partner, Sue Tisdale, who works over at Carl Health at Trillium Place, she really focused a lot on equipping organizations and community members and community organizations with Narcan.
I train and actually distribute nasal naloxone. And the grants that I work under, a drug overdose prevention program grant and an overdose education and naloxone distribution grant that covers 40 counties. I cover 15 of those counties. So basically I can train anyone, any group, any organization, and then equip them with nasal naloxone absolutely free. We have currently 3 vending machines in Central Illinois. We have one located in Peoria downtown at CityLink bus terminal. It's accessible, I think it's from 6 a.m. till 10 p.m. at night. And it has basically nasal naloxone in it and fentanyl and xylazine test strips. A regular snack machine, you go up, select what product you may want. For instance, maybe F3, push the coinciding letter and number, and it will disperse for free the product that you choose.
Along with the vending machines, some community members all over the area are working to get Narcan right into the community. It's all to prevent opioid overdose deaths. Jolt Harm Reduction goes out into the community and even into trap houses. The Peoria Fire Department makes sure people who need Narcan get it.